we've done a disservice by this wrong-headed idea, which is that by the time you're a certain age, 25 or 30, you've built all the bone you're ever going to have, and all that happens the rest of your life is it can get worse. And the reality is we're constantly in a process of building and breaking down throughout our whole life.
Hey there, I'm Bria, and welcome to the Period Whisperer podcast. If you're over 35 and ready for real answers about your hormones, you're in the right place. Hit subscribe and stay with us. Hey there, sisters. Welcome back to the Period Whisperer podcast, where we discuss all key areas of midlife to help us understand our bodies more, the messages that they give us, and how to optimize this incredible transition in our lives. I think you're going to be just as excited about this conversation with my guest today. Midlife is this fascinating pivot point where we as women start paying attention to our hormones, to our muscle, to our metabolism. But as we all know too well, in our guts, quietly underneath all of that, something else is definitely shifting. Today, we are talking about bone. Bone is living tissue. It responds to estrogen, to strength training, to nutrition, to stress. And for many women, bone loss doesn't start at 70. It starts much earlier and accelerates during perimenopause. Today's guest, sports chiropractor, functional medicine practitioner, and host of the Rational Wellness podcast, Dr. Ben Weitz, joins us and is going to bring a powerful perspective because his expertise isn't just theoretical. After a traumatic femur fracture that wouldn't heal, he had to navigate a full-blown health crisis and rebuild his own bone using advanced nutrition, rehabilitation, and anabolic strategies. This is a conversation about strength, about strategy, and how midlife women can build bone proactively instead of reacting to a DEXA scan years too late. I'm very excited to welcome Dr. Ben Weitz to the show. Welcome.
And I'm very excited to join you and your audience.
Yes, me too. I'm really pumped about this conversation. I think so many more women are becoming aware of this. And you have a really powerful story. So let's dive into that. I was so
The interesting thing is being involved in functional medicine. I've always heard these other practitioners talk about how they had a parasite and they had this health crisis, and that's how they got into functional medicine.
Ah,
And I always felt a little inadequate because I never really had a health crisis. Not that I was hoping to have one, but
yeah.
so I I finally had my health crisis, which happened on the Halloween night of 2023. I was doing the very vigorous act of handing out Halloween candy.
Jerry identity.
The relevant thing, I think, is that I had both my hands full. So I had a bowl of candy in one hand and the dog's leash on the other hand, because we have this very excited golden doodle that loves kids, but would jump all over them and they'd be afraid. So each time I opened the door, I had the dog's leash. Anyway, so and I also had socks on a wood floor, and I I had closed the door. I was backing up. The dog pulled. My leg slid. I went down right on my greater trochanter, and I had a traumatic fracture. At first, I didn't realize what happened, and my wife offered to help me up off the floor, and then I looked down, and my right leg was out like this, and I thought, "That doesn't look right. I think I'll pick it up. Oh, I can't pick it up. I think my leg is broken," and, ended up at the emergency room, and, I had a traumatic fracture. I got surgery the next day. Um, and unfortunately, after the surgery, what was supposed to have happened is that the two parts of the bone were supposed to be like this,
Yeah.
so then the body could mend them together. Unfortunately, I ended up with a gap. And so, whatever reason that happened, it happened. And so I, I started with my rehab, my bone building program using all my knowledge of nutrition. And after 4 months, I kept going in and getting an x-ray once a month. And every month there was a gap. And so after 4 months, the gap hadn't closed yet. Now, it may have been starting to close with fibrous tissue, but there wasn't bone formation yet. And even the fact that there was potentially some fibrous tissue there was some controversy with different experts I talked to about whether or not that would even be a good idea. So um, bone forms on a matrix of cartilage and collagen. And so having fibrous tissue could be the basis for bone to then eventually form, or it could be getting in the way of the osteoblast forming new bone. But anyway, so I then went to seek advice from several different orthopedic surgeons who advised me that after 4 months, it was a non union and it was not going to heal on its own if it hadn't healed by now. And that's just based on statistical averages.
Right, right.
And I never considered myself a statistically average person. So uh,
Love that.
and I also have a lot of knowledge about this stuff. So I was told that the only way to heal this was to pull. So I have two metal rods inside my femur that are attached, and they would have to go and pull those rods out, stick a rod down the side of my femur with a whole bunch of screws down. And I looked at this diagram in this orthopedic surgeon's office, and I looked at the surgeon. I said, "There's no friggin' way I'm going to do that." And he said, "Well, if you don't do that, your leg's going to collapse." And I said, "You don't know that. And if my leg collapses, I'll be back. But right now, I'm not doing that." So I had to figure out, well, what I was going to do to get this bone to heal.
Oh, sorry. I wanted to
Yeah, go ahead.
things you were doing, from your arsenal, from the education and the knowledge that you had to begin to work on this before you got to this point.
Right. So first of all, I got some labs. I've always struggled to keep my vitamin D level. My goal is to keep it at 50 to 70 nanograms per milliliter. And I take 5,000 a day typically, and it'll drop down to 45 and it'll go to 10,000. I'll get it back up to 60, 65, and it'll drop down. So my level was in the 40s again. So I went to taking 10,000. Of course, I always take it with vitamin K. And then I decided to start taking some additional vitamin K. And vitamin K is very important if you take vitamin D. And there's different forms of vitamin K. There's K1 and then there's two forms of K2. There's the MK4 version and the MK7 version.
I don't think I knew that.
What's very common today is to take the MK7 version because that's the newest version. It's it's patented. It's more expensive. It has a longer time in the bloodstream. It has a longer half-life. So it's considered to be better. However, I did a deep dive into vitamin K research. In fact, I did a whole podcast on it. You can look back. I forgot the number. I think it was in maybe 290 or 300 or something like that. So when you look at vitamin K2, there's the MK4 version is the form that's been used in Japan and is even used as a prescription
Okay.
for osteoporosis.
Okay.
And the in the United States, we typically will have MK7 at a dosage of somewhere around 100 mcg. Um, Sometimes they'll use MK4, and typically it'll be a similar dosage, 50 or 100 mcg. Now, the best data on healing of bone and overcoming osteoporosis is with 45 mg. So that's 45,000 micrograms. So I looked around and Designs for Health recently came out with a new product with 45 milligrams of MK4. And so when you look inside the bone, when you look at vitamin K in the body, depending upon what tissue in the body, uh, most of it is stored as MK4. Some is stored as K1.
Okay.
Only one organ, the liver, really stores it as MK7. So there's a lot of reasons to think that both K1 and MK4 are beneficial.
Okay.
And so there's also another product called GG, which is geranol, which also helps the conversion. So Designs for Health also includes that in their products. So I made sure I was taking the higher dosage of the MK4. along with the higher dosage of D. I also added calcium, magnesium, which I had stopped taking. And this is another one of those controversies in the world of nutrition where a lot of people have been scared off of taking calcium.
Definitely. We see the
Calcium's going to cause calcification of your arteries.
calcium cells. We're not getting things into the intracellular level. We're not getting those minerals.
Yeah, so I don't think that's accurate. I think that the studies that were done that seemed to show, first of all, the whole reason why those studies were even done was because there were previous studies showing that when people took calcium supplements, they actually had better heart health. They had lower risk of hypertension. They had lower risk of heart disease and heart attack. And so all of a sudden, a few studies seem to show the opposite. Now, in my opinion, they weren't great studies. The patients were not taking adequate levels of vitamin D, and they weren't taking vitamin K2. So one of the reasons why vitamin K2 is so important, not only does vitamin K2 carboxylate the osteocalcin, which makes sure that you form new bone, but it also carboxylates the matrix gua protein that makes sure that you don't calcify the arteries.
Oh, wow.
So, because vitamin D is designed to take the calcium and bring it into the bones, and then vitamin K makes sure it doesn't end up in the arteries.
That's awesome. That's a great explanation, I think, because a lot of people are curious about that. Why calcium?
Right. So it turns out that modest amounts of calcium that can be absorbed
Right.
are beneficial, and they're certainly important for bone health. Now, you probably don't want to be taking thousands of milligrams at one time, but to take 3, 4, or 500 milligrams several times a day is good, and especially to take with food when you have hydrochloric acid secretion.
Right.
And interview that we did on the rational wellness, the importance of gut health, you got to make sure you have proper hydrochloric acid secretion, which not everybody does. So taking some digestive enzymes that has some HCl can be a good idea, or to use herbal bitters that stimulate your own hydrochloric acid secretion can be helpful. But so I started going back to taking some calcium with some magnesium. I also added boron, which can be very helpful. I also added strontium citrate, which is another controversial mineral that there was some data showing that it was potentially beneficial. Then a company came out with a patented form called strontium releonate, and they found it was potentially harmful. And then everybody said, don't take strontium. The problem was that relin- renolinic acid is known to have a number of negative effects, and taking strontium releonate that had some side effects, it's most likely due to the form. So calcium citrate doesn't have those same issues. So I made sure I started taking strontium citrate. One thing is you want to take it at a separate time of day from when you take your calcium.
There's so many nuances to this that I don't think people, I mean, sometimes I'm like, how are people to understand all of this?
Right.
Well, as we say, there's so much information that you learn just through this journey with your own practice.
Yeah.
There's but I guess that's why we need support.
And so I was going to use everything. So I also looked at prescription medications.
Okay.
And so I took a medication called Forteo,
Okay.
and Forteo is one of the few anabolic bone drugs.
Okay.
You need to understand that in the categories of drugs for osteoporosis, potentially also for healing of a non-union fracture, there are two main categories of drugs. There's some anabolic drugs, of which Forteo is one. Timlos and Evenity are two of the other drugs. And these are drugs that stimulate osteoblastic formation. So in the bone, there's osteoblasts and there's osteoclasts. Osteoblasts lay down new bone, osteoclasts break down bone.
Okay.
And just like with muscle, you work out, you break down muscle, you build muscle, and there's a balance.
Yeah.
As we get older, the balance tends to shift where you lose bone depending upon what you do, but it doesn't necessarily have to be that way.
Yeah.
And so what's the most common classification of drugs that people take with osteoporosis is they take drugs that block bone breakdown. So The most common category of drugs are called bisphosphonates.
Okay.
And these are drugs like Fosamax, Actonel, Boniva, and they classify them as anti-resorptive drugs.
And they're designed to keep the bone from doing its one process of breaking down.
Exactly. Now, but you got to understand, why is bone being broken down at all? Why would the body want to break down bone? Well, this is kind of like the cleaning crew that comes in, because normal activity, just going through your day, even if you just, mm, cleaning the house or doing anything that's all physical, you actually have micro fractures in the bone, which is normal. And then the body rebuilds it.
Yeah.
And so when you have the osteoclast cells come out, they clean up that broken bit of bone, they sweep it away, and they allow for better, healthier bone.
If you are not breaking down, if you don't have this cleanup crew cleaning up the broken down, is it kind of like being a hoarder? Or now we're in this like home and like more bone is just being built and more bone and nothing.
You got it. You got it. And that's exactly why a lot of the data that looks at these drugs that block the osteoclastic activity, they tend to show more bone density, but there's very little data, only, a trace in a few studies that shows it stops fractures or reduces fracture risk, because that bone is now weaker potentially.
Because
And not only doesn't it do what you really want it to do, which is prevent fractures, but you end up with some weird fractures. Like there's a weird spiral fracture of the femur, and you get um, osteonecrosis of the jaw and some other negative side effects from potentially taking these bisphosphonates.
but this was not what you went on.
So I went on an anabolic drug, the Forteo. Of course, the surgeon didn't know anything about it. So I dug up the research, sent him, actually sent him a meta-analysis that showed that it was helpful in healing of non-union.
Yeah.
So I took an injection of Forteo every day for 5 months.
Okay.
After consulting with a lot of my friends in the functional medicine world and looking at the data, I also decided to use human growth hormone.
Okay.
And so the surgeon didn't want to prescribe that, but a functional medicine doctor friend of mine did. And so I got a prescription for human growth hormone from a compounding pharmacy. And I did 2 IUs of that 5 days a week for 5 months. So I had to take 2 injections most days. But it was fine. It was, subcutaneous. I just did it in my abdomen, and it really wasn't a problem at all. I'm not used to taking injections, but I adjusted to it well. So I did both of those. And then and the reason for the human growth hormone is you just put my body more in an anabolic mode. So it was in the process of building new bone.
Yeah. Healing.
Yeah, so I'm taking a drug that stimulate osteoblast formation. We've got an overall concept of forming new bone. I also used a ultrasound-based bone stimulator I put on my hip, and I did it twice a day for 20 minutes.
And then you were taking your minerals, as you said, your vitamin D, your calcium, your magnesium, your K.
Also, I took collagen, glucosamine, and chondroitin, because they help form the collagen matrix that bone is formed on. Probably use collagen or glucosamine and chondroitin.
Oh, definitely. Yeah, I,
Yeah.
I use it frequently in my practice for sure. And we know it helps as these building blocks.
Yeah, it turns out glucosamine and chondroitin not only can help rebuild cartilage, but patients who take those regularly have a significant decreased risk of heart attack.
Right.
So, yeah, it's very significant. It keeps the arteries more flexible by having healthy collagen. So there's 3 or 4 studies showing that glucosamine and chondroitin significantly 30 to 50% reduced risk of heart disease.
Wow, that is significant.
First, I went to a rehab hospital for like 5 days after the injury. They talked me into it. They claimed I was going to get this very vigorous rehab, and it wasn't quite as vigorous as they said it was. It was for a couple of days. So I got out of there. Not only that, but the food was so lame.
Ah, terrible. It's a real problem.
A week after leaving the hospital, I was in Gold's Gym with my walker. I wasn't gonna let breaking hip take me down.
And so how long was this? So from when the doctor said you need to have this surgery with the rod and you said, or your leg will collapse and you said, I'll see if it collapses. I'm going to do this on my own. And I mean, is there a spoiler alert here? I mean, I feel like I know this, but like you did get your bone to heal, did you not?
100%. Yep.
100%.
Yeah, it took another 5 months, so a total of like 9 months.
9 months through
Yeah.
this protocol for yourself.
Comes to bone healing, I wanted to mention it's important to do labs. I know you're a big fan of labs, but there's a lot of labs that are never run that can be very helpful to monitor what's going on.
What are your favorite? So, and you're talking, so we're talking to women in perimenopause and menopause here, who may or may not have had an injury like that. So it's
Right.
relevant.
Or maybe they just have low bone density. They got a DEXA scan. By the way, there's a whole bunch of issues we can talk about with DEXA scans. Let's say they have osteoporosis, they have a decreased T-score of minus 2.5 or beyond. Let's say they have minus 3.5. And now the doctor says, well, first of all, we can talk about the drugs. I think you should go on bisphosphonate.
Yeah.
There's a newer protocol that says you start with an anabolic drug, you take it for a period of time, and then you follow with an anti-resorptive drug like a bisphosphonate. But first, you put your body in an anabolic mode. The reason why the anabolic drugs are not recommended for a long period of time is the same thing you said about the growth hormone, is that there's a risk that if you're stimulating growth for too much for a period of time, you could have an increase, say, in bone cancer or something like that.
Yeah.
And there's no human studies, but there's some animal studies that indicate there could be a risk, but only after taking it for a couple of years.
Right. Okay.
So the new thinking is you use an anabolic drug for a year or so, and then you follow it with the bisphosphonate. But of course, there's an even better way to do it, and that's by actually testing, which the medical profession doesn't want to test because the insurance companies don't want to pay for it.
So what kind
It's
are you recommending people?
okay.
Yeah. Let's
Yeah. So there's a test called CTX,
CTX.
which is a measure of bone breakdown.
Okay.
It's important that when you get this test done, it's a blood test, that you have it done in the morning fasting.
Right.
And then there's another test that indicates bone formation, which is the P1NP.
P1NP. Okay.
And both of these tests can be very helpful to know where you are, how much bone formation, how much bone breakdown is occurring. And then if you're going to use medication, how is that medication affecting those? So one of the reasons for recommending an anti-resorptive drug after an anabolic drug, you're going to get a rebound increase in bone breakdown.
Gotcha. That makes sense. That people would think.
So, the osteoblasts are stimulated, and now all of a sudden the osteoclast gets stimulated. You stop the osteoblastic, and now you got all this bone breakdown. So then you take an anti-absorptive drug to quench that. But I think better than doing that is see if you really need it.
Yeah. And that's where these two tests, the CTX.
Exactly. So if you didn't get a big increase in osteoclastic activity, it's probably not needed to take a drug that's going to block that.
I'd like to move into a little bit, like for the women listening, I think, maybe you can just give us a more general understanding about what happens with bone loss. I think a lot of women think that they don't think about osteoporosis or bone loss or osteopenia until their 70s or even late 60s.
And part of that is because we don't even test them till they're older.
Interesting. And are these the tests that they're being tested on when they're older? Or
No, nobody does these tests. They're doing a DEXA scan.
a DEXA scan? That's what we'll typically do at a certain age to determine,
Yeah, they typically do it at 60 or older, but why not do it at 40? See where you're at then.
Yeah. Yeah. And so we can ask for these tests. It might not
Yes.
be covered in insurance, but we can pay for these tests.
Absolutely. And when you do a DEXA scan, it's important if you get two different scans that they're both at the same lab with the same machine.
With the same machine. Okay.
Yes, because machines have a different readout. They use different the formulas, etc. And and then you want to make sure that they position you just right with your hips slightly rotated internally. You also need to know if you have a significant amount of osteoarthritis
Mhm.
or scoliosis. Because when it comes to looking at your spine, if there's a big curvature or you have a lot of you have a lot of bone spurs from osteoarthritis, that can artificially throw off the reading.
Oh,
So bone spurs will make it look like you have more bone than you actually have.
ah,
Having curvature like scoliosis can sometimes make it look like you have less or more depending upon the level. And then you also want to make sure you get the full printout because usually they just give you this quick summary. Say you have osteopenia, you have osteoporosis, and they usually give you the T score. So there's a T score and there's a Z score.
okay.
And the T score is comparing yourself to a healthy, say, 25 or 30-year-old. And
Okay.
then there's a Z score that's comparing you to someone similar age.
Okay. So you get to kind of see where you rank.
And typically the T-score is what's used to tell you whether you have osteopenia, which is some loss of bone, or osteoporosis, which is a lot of loss of bone. And if the T-score is -1 or more, that puts you at osteopenia, and if it's -2.5 or more, that puts you at osteoporosis.
Okay.
But you wanna get the full printout where it actually shows a diagram of exactly what it's looking at, and sometimes they actually don't do they don't scan the exact part of the bone that's supposed to be scanned, etcetera, so it's important to look at that. And and then if you can get these blood tests done, which once again, doctors don't typically recommend, insurance companies don't wanna pay for,
Yeah.
but it would be a good idea to get both of those tests done, as well as probably a 24-hour urine calcium level.
If I'm 44 and if I'm
Yeah,
here coming to you, like Dr. Ben, I just want to optimize my bone health going
yeah.
forward, knowing that I'm in this, time where I think it's getting a bit riskier with our hormones. Is that what you would initially recommend? Get a DEXA, but know all of these things and get these.
I would definitely get a DEXA just so you know. Hey, if it's great, you don't need to get it again, maybe for another 10 or 15 years, but see where you're at. Let's say you're already in osteopenia and you had no idea.
Yeah.
So, and then you want to do those things that are going to help to reverse that, which also includes the right type of exercise, which a lot of women are not doing.
Oh, let's talk about that. What are the right types of exercise that actually build stronger bone?
Right. Well, here's the thing. I talk to a lot of women. They go, "Yeah, I do weights. I have 5 pound dumbbells. That's not going to do anything." You got to load the bones.
Loads the bones. Okay. So what does that look like? Like in a bicep curl, like I've been working out forever. I mean, it's hard for me to curl more than 15 pounds for very long. Is that heavy enough?
Right. Well, it turns out that when you look at studies on using resistance training for increasing bone density, a lot of studies have not really been shown to be effective. And one of the few studies are the Lift More trials, LIFTMOR
Okay.
trials from Dr. Belinda Beck from Australia. You can look up those trials. She's led some of the few trials that have really shown a significant improvement in bone density. And there's two very important parts of her trial. You have to do these big compound movements and you have to do heavy weights, and you also need some ballistic training. So she has women do 5 sets of 5 rep max on deadlifts, squats, overhead press,
Okay.
and then she also has them jump up onto a pull-up bar and drop down
So
and get
they're
that
in
ballistic
bar.
loading.
Got it. That ballistic. I like that you explained that what ballistic loading is. So
Now, if you've never done anything like that and you have severe osteoporosis, obviously you got to be really careful about just doing something like that. It's something you got to gradually build up to.
So using this kind of formula is, and how many times a week would we need to do something like this incorporated with our other, fitness routines?
Yeah. Now her studies were with women doing it 3 times a week. In my experience, I have found that if women do those core exercises with heavy weights, um, at least once a week, along with other heavier weight training exercises, um, I've found they usually get great results. But they can't just do 5-pound dumbbells. You've got to really load the bones, and you want to make sure you load the spine and the hips, as well as all the other bones.
How does that actually work? Like, how does that, like in the body, how does that actually start to stimulate more bone growth?
It's just like with muscle. When you working out is not a build-up process. Working out is a breakdown process. So you stress those muscles, and then the body stimulates the healing to build new muscle, to strengthen those myofibrils so that putting that same load doesn't cause stress anymore. And same thing with bone. You break down the bone, you cause microscopic damage, like you cause microscopic damage to the muscles in your workout, you cause microscopic damage to the bones, and then the body says, let's bring out those osteoblastic cells and let's build it up. Let's strengthen these bones.
I am endlessly amazed at the body's adaptability and desire to survive. It's like, oh, this is happening now. Then we have to, enlist these forces and make this so that we can be stronger. Like, it's fast.
We've done a disservice, unfortunately, by this wrong-headed idea that exists in a number of parts of medicine, which is that by the time you're a certain age, 25 or 30, you've built all the bone you're ever going to have. And all that happens the rest of your life is it can get worse.
Huh.
And the reality is we're constantly in a process of building and breaking down throughout our whole life. Same thing with the brain. They used to say you got all the neurons you're ever going to have by the time you're 25 or 35 or something like that, and you just lose neurons. And that's not true. We're constantly building and losing neurons, and it's a question of the balance. So you've got to stimulate your bone the way you stimulate your muscles, the way you need to stimulate your brain.
Can you remind me again, what was the name of the woman whose study you were just talking
Oh,
about?
Dr. Belinda Beck.
The back. Okay.
Now, because of this ballistic loading and the fact that ballistic loading has this really profound effect on increasing bone, um, somebody came up with the idea of using machines to be able to load the bones supposedly at 4 times the body weight. And so there are centers that use these machines, and it's a short, like 10-minute exercise session. And you're basically just like holding a weight or with your legs or pulling, but it's kind of an isometric type movement. And they claim that they're able to put that same load you get from ballistics. But there's very little data on using those machines.
Okay.
I personally have had a number of people go to those places, and some said it's really helped a lot, and that's great because they're very safe. But uh, Dr. Beck has told me that she included using that program in some of her research, and they found it really had no effect.
Oh, interesting. Okay. Okay.
So there may be some benefits in some patients, but until we really see good randomized trials showing that that type of way of loading is beneficial, I would say at this point, we really don't have good evidence that it is.
Yeah. No, that's fascinating. It's always good to look at the data, right? And to go off
Right.
of how your body feels.
Yeah, I like to have women start by just doing heel drops.
Mm,
They just go up on their toes and just drop down,
okay.
and then slowly progress to being able to get off the ground and have that impact loading.
And slam down, back down onto it. So
What I do now to make sure I keep maximal level of bone density is I get up on a 24-inch platform and just jump down.
how many times do you do that?
I do that 10 times as part of my workout, along with heavy deadlifts and heavy squats. And, I've done weight training my whole life. I'm 67. I've done it for, 50 years.
You're a very youthful 67
Thank you.
of your work. Okay, so if myself or one of my clients, we're 40 to 55, we're coming to you, we're like, okay, I'm gonna do this testing, I'm gonna get my DEXA scan so I know where I'm at, I'm gonna do the CTX, the P1NP, I'm gonna start stimulating bone by doing ballistic loading and this type of work that you're saying. Then I assume we need to support with some supplements or nutrition. Like, what do you recommend as like maintenance here? If everything's good, but we need maintenance, what would you recommend for me or for the women listening?
Well, number one, you got to make sure you get your vitamin D and keep it in that level. I can't tell you how many times patients have gotten a vitamin D test,
Yeah.
been told to take a supplement, and that's it. Nobody ever measures their vitamin D again.
Oh, I know.
It might have not even been close to the amount. A lot of times they've come from their primary care doctor who tells them to take 1,000 milligrams because they're kind of afraid if they give them too much.
Yeah.
And usually there are some people where 1,000 or 2,000 milligrams can move the needle, but a lot of times it doesn't even move the needle enough.
Yeah.
They start out with 25 and they get to 30.
Yeah. And
And then again, some of the conventional labs will say like the range is from 30 to 50. And if it's over 50, it's too high.
yeah. No, I mean,
I've had patients come in and say, "Oh, my doctor says my vitamin D of 60 is too high, so I have to stop taking it."
60 is where we're trained in functional.
Exactly.
Yeah, 70, it's like 60 is the mid, like where we want it, kind of.
Exactly, and their studies show a significant reduction of risk of breast cancer and for bone health and for so many other things. And this whole concept that, you know, um, having calcium is gonna cause, problems with your arteries is just mostly wrong. Not to mention calcification of your arteries is not necessarily a bad thing if it's calcification of the plaque,
Yeah. Yes. Yeah.
because the biggest risk is with soft plaque, not with calcified plaque.
Yes. I love that you shared that. Yeah. This vitamin D piece is very fascinating. So if with the women that I work with, I commonly see this with low thyroid conversion. I see low because vitamin D is required for thyroid conversion,
Yeah.
magnesium is required. We start to see just issues all around the blood work. As soon as I see those that thyroid conversion sluggish, I scroll down vitamin D and sure enough, there it's low. So
Well, I know about the thyroid thing. I deal with Hashimoto's with myself as well.
how often do you recommend testing vitamin D when we've seen a deficiency and we're working on it? Like how often? Yeah, how frequently do you run a
A
test?
couple of times a year, and it's important to test it in the winter as well as in the summer because you need to know when you're getting a little more sun, where's your vitamin D as compared to when you're not. So you may need to titrate your dosage, but I think it's great to get testing done on a regular basis. So, if it's too low, if it's too high, if you're actually doing what you're supposed to be doing, and then just constantly titrate it to where you're at.
And so vitamin D, and do you like a liquid vitamin D3 K2? Do you or we kind of broke down the
I'm not convinced myself that liquid is any better than capsules.
okay. So at sometimes
Um,
a lot more in a capsule, which is why I ask.
yeah, and there's different forms of capsules. There's capsules with dry powder. There's capsules with in a fat soluble form.
Yeah.
I have found that the fat soluble form sometimes is more effectively absorbed in patients who have trouble absorbing it. I ask them to consume it with a high fat meal with a meal that has a certain amount of fat, so the bile and the lipase is secreted. But I've had a conversation on the podcast with Dr. Michael Hollick, who's the world's expert at vitamin D, and he says that doesn't matter at all. But
That's so interesting. Okay. Okay, we wanna take our vitamin D, we wanna take our vitamin K. What else? What
yes.
other ingredients that we wanna be taking for maintenance for those of us who are like, "I'm okay."
Yeah, I think the vitamin K. I'm gonna take the 45 milligrams vitamin K the rest of my life.
Okay, I like that.
So, I'm taking a product called BRF from Designs for Health. I'm going to continue to take the boron. I stopped taking strontium citrate. Um, but if I had osteoporosis, I continue taking it. Calcium, magnesium, I'm continuing to take modest doses of that twice a day after meals.
Can we get modest amounts of calcium through just nutrition?
You can, green, dark green leafy vegetables,
Yeah,
um, especially collard greens and Swiss chard.
the bitter ones.
Yeah, the bitter ones. Those are also good sources of vitamin K1. And I like measuring vitamin K as well. I love doing the vibrant micronutrient test,
That's a good
which
one.
looks at short term and long term and includes vitamin K1 and 2.
Yeah, I like that. Tell me more about boron and how it plays a role in bone health.
So, boron is a mineral that helps with hormonal balance. Some studies have shown it may be beneficial in helping with testosterone, not artificially jacking it up, but just making sure you can produce enough, like you were talking about, having the right nutrients so your body can make the hormones it needs.
Yeah,
And it's also part of the bone matrix.
yeah.
So,
Okay.
bone is a matrix of minerals.
That's fascinating. Okay, so this is some.
Boron, you don't need a lot of, like 2 milligrams twice a day is probably optimal.
Yes, I like this vibrant micronutrient test you talked about. I started to use it as well in my practice. I find it fascinating. So that can be also very helpful in as a part of our testing and knowing what we might need with these specific minerals for the bone.
Yeah, zinc is another mineral that's important for bone, part of the bone matrix. And, you know, because of COVID, a lot of people might have probably gotten too much zinc because everybody was taking zinc, but most people generally could use some more zinc, but it's good to test it and also test the level of copper to make sure they stay in the right balance.
Yeah. Yeah, I think
As you know, balance is super important.
in all of these minerals, it's quite fascinating.
Absolutely.
Such an interesting and again, that's why I'm so grateful to have, experts like you come on the show and walk us through because we were talking earlier, it's complex, for like you and I live and breathe this stuff, but for someone who has a passion that is a very important passion, but not in this industry, how are they to know this information? We need to.
Right, and just like taking the GLP-1s, if all you do is take that, osteoporosis drug, that bisphosphonate, whether it be Actonil or Boniva, that your doctor recommended, and you're not doing the heavy resistance training with some ballistic loading, you're not taking adequate levels of vitamin D and K2 and calcium, magnesium, and boron, and you're not eating the healthy diet with adequate levels of protein because you need adequate levels of protein to form bone,
Yeah.
um, then you're not going to get the you're not going to get the benefits of taking that.
It's a full-time job to be healthy.
Absolutely.
Effort and be healthy than the exhaustion of being unhealthy. I love that.
Absolutely.
Dr. Ben, if we do the testing and we see that things are off, whether it's in the DEXA scan, how soon after do you recommend we test again? If we can, I do this testing, maybe I see there's a bit of osteopenia happening, so I get on it with my, bone stimulation, with my ballistic, my heavy lifting. I get on it with my nutrients that I need. How soon after do we expect to see a change?
Well, that's one of the benefits of doing some of the blood testing because the DEXA scan takes a while. Typically, it's not recommended to do one more than once a year.
Okay.
You could do it in 6 months, but typically once a year. But in between, you can see where your body's headed. Are you building bone? Are you breaking down too much bone? Where is that balance?
Yeah, this is fascinating. I'm writing these.
And that can be done, every 2, 3 months.
Yeah.
So you know exactly where you're at. We really should do more testing to see where we're going. Are we improving?
Yeah. Yeah.
That should be built into our healthcare system. Unfortunately, it's not. It's another problem with the many other problems we have with our current healthcare system.
Yeah. That's another episode altogether, isn't it?
Oh, but the whole point is not wait till you're really sick and have a serious condition.
Yeah, you're right. I think that is the nature of what we've been taught. Let's wait until you don't feel well to figure out how to get healthy instead of figuring out where you're at when you're healthy and how to stay there.
Yeah, and let's wait a long time before we test anybody because we don't want to waste money on testing. So, they had a task force come out and start saying that we shouldn't be testing men for prostate. We shouldn't be doing PSA testing because if we do, then they might rush out and get surgery that they don't necessarily need. So we're going to put off testing till much later. And then what happened? Oh, hey, there's more cases of advanced prostate cancer being found in younger men. Oh, I guess that wasn't a good idea. Let's go back to testing. They let's not do colonoscopies until you're at a certain age because otherwise we're wasting money. Oh, wow. Now there's a dramatic increase in the number of patients with colorectal cancer at a younger age. And of course, we know one of the reasons why that is, the ultra processed food diet that people are eating, the lack of exercise, spending their whole time on their phone or their computer or playing video games.
Dr. Ben, this has been super enlightening. I feel like I always love leaving these knowing that I feel really clear on like, okay, what are the next few steps that I want to be taking to feel optimized in this area? And I hope the women listening were able to get that as well. Is there any last messaging we missed that you think you'd like to leave, especially for women in midlife around this?
There's always hope. Your body's always changing. You can always move it in a positive direction. Don't think just because you're old, it's all over.
Yeah. Yeah, I think you're a perfect example of vibrancy in that area and reminding us. So, thank you so much for your time today. I've really appreciated it. Where can everyone listening go if they want to get into your world, if they want to learn more from you?
Absolutely. So first of all, listen to my podcast, the Rational Wellness Podcast, and you can find that on Apple, Spotify, on YouTube, wherever podcasts are found. And you can go to my website, drweitz.com. That's drweitz.com. And you get our office phone number, which is 310-395-3111. I'm available for functional medicine consultations. And in person, you can see me for chiropractic care as well.
Very cool. Thank you so much. I will put all of those links in the show notes. Dr. Ben Weitz, thank you so much for being here today.
Thank you so much, Bria.
Yeah, and sisters, now I think we have some really clear, cool, empowering steps to go out and be more in our lives and not just less on a scale. We'll catch you in the next episode. If you're 35 plus and ready to stop guessing, start understanding your hormones, and feel your absolute best, hit subscribe. That's what we do here.